This conference will now be recorded.
All right, welcome everybody. For the purposes of this recording, my name is Rod Soto, and I'm with Pacific Hackers. And today we have two presentations. The first one is Faraday, and the second one is Bioinformatics. And I'm going to give the floor right now to Josh from Faraday, and hopefully we'll see a lot of cool stuff. So Josh, take it away.
Awesome.
I just set you as a presenter.
Yeah. Is everyone seeing my screen?
Yeah, you're good to go.
Awesome. Cool. Okay, so my name's Josh Mador. I'm the VP of Business Development over here at Faraday. We have Emilio, who's one of our sales engineers. He'll be doing kind of the technical presentation. So I'm just going to do a really quick high-level overview. So Faraday, pretty much, we started as a consultancy company, kind of the whole gauntlet of offensive security services, pen testing, vuln assessments, red team services, code review, and on-site stuff when they let us. Sometimes we like to break things. Then we research branch of the company as well. So we're looking for 0 days and trying to kind of be on the cutting edge, what's happening in the industry and everything. Pre-COVID, we've been BlackHat sponsors for 5 years, so we're going to all of those events. We're global sponsors before the pandemic hit, and we organized our own event in Argentina called Echo Party, which is really cool. So if you guys can ever make it down there, highly recommended. So we originally started making Faraday for our team internally, and we hated writing reports, so we wanted something to help with that. We've developed it a lot since then. Because we kind of realized there's a gap in the market for something like this. So pretty much Faraday is a platform for collaborative penetration testing and vulnerability management. And the idea is to be, really flexible with your tooling. We have more than 80 supported plugins and a lot of open source stuff, a lot of commercial stuff, kind of the more the merrier. And get all your outputs from all those different tools, your scanners or whatever, your manual stuff into Faraday, and standardize, centralize the information, kind of be able to sort of prioritize, what's happening for a specific project and everything. And then help automate different pain points, whether that be, report generation, different parts of the vulnerability management process, um, kicking off sort of routine scans. And pretty much the idea is, sort of to make your guys' lives easier. Okay, so now it's time for the demo. Can we give the presenter to Emilio now, Rod?
Yeah, where are you at, Emilio?
Thanks. Can you guys hear me okay?
Yeah, hold on. You got it.
Yeah, give me 1 second. How do I know what I'm presenting? Okay, I think he only allowed me to present tabs, not the whole screen. Okay. Can you guys see the screen?
Yeah, you're good.
You good? Oh, you cannot see me, right? No.
I see the sign in window if that's what you want to show us.
Yes. Okay, good. All right, let me start with the introduction. This is I'm just running a local instance of Faraday in my machine, but this is the GUI, which is a web interface. So let me Let me log in. Okay, go. So Faraday has the concept of we call workspace. So I create a bunch of workspace already. So let me create another one. Let's create another one. Let's call it November, maybe. You define an end date, the users that are allowed to see the workspace scope, and if you want to make it public, a description, a few details if you want to. And then you select actually the workspace you want to work on it. Right. As you can see, these workspace, they're all empty actually. So before we start, let me run, because this is going to take time. I probably can't see the screen. Can you see the screen? Yeah. Or can you see burp? No?
Yes, we can see the well, now it just went away.
No?
Sorry. I saw it, but then it just disappeared.
Okay. Let me see if you can see it now again. Yes?
Yeah.
Okay, great.
Yes.
I'm pretty sure that everyone is aware burp is a tool is a proxy for audit, and it's very popular. So what we did here to integrate burp into Faraday is something called burp extenders, which are extensions that you can add. So we create a client in Java. So let me say, where is it? Burp. There you go. So let me first of all add this. It's an extension that you can add into burp. And now you have a tab called Faraday at the end, and then you can connect to it. And of course, I need to log in. And say yourself login, and you can select the burp and also the workspace. And you can also select if you want to auto import vulnerabilities or do it manually. That aside, this is an empty burp. So what I'm going to do, you still see the screen, right? Just let me know when you don't see the screen. So because this takes time, I'm going to run an agent. Before, I know I will explain you something later, but for now I need to run it. So let me run it because it takes time. Oh, I lost the window. There you go. Okay, going back. So I have a completely empty dashboard. So what I'm going to do now, I got the option of creating workspace, adding vulnerabilities into the workspace. The way we do this, and assets and credentials.
We're still watching the burp.
Okay. How do I change that?
You may have to, yeah.
Share, reshare.
Mm-hmm.
Okay, now are we good?
Good. Yeah.
Yeah, great. Okay, so we have the ability to actually import vulnerabilities from different tools like Nessus or different scanners or manual vulnerabilities. So this is multi-user as well. So we can have multiple users. In this case, we have 2 users. One is an administrator, the other is in different roles. So let me go and then select the file. I'm going to import a Nessus scan, which is Nessus, and upload the file. This is done manually. I'm showing you here through the GUI. Then we will move into the CLI and automation part. But just to, so you will see that the vulnerabilities count start to go up because it's importing all the Nessus vulnerabilities we just give the report. And this is start to get populated a bit more with color, 246. If I refresh, I should have around 300, I believe. Yeah, 333. Okay, so the main dashboard will give you what is the latest vulnerabilities, hosts, services, activity feeds, and history commands of what has been done in this particular workspace. And if I move into the manage part, you can remove columns and order by, let's say, severity. Right? Or you can also put confirm and confirm. There's a lot of features that you can actually add and remove columns, play with it. And if you go to the host part, you will see the assets you have and how many services each has and vulnerabilities each has, and you can put descriptions, and there's a show and search, some information. Credentials also allow you to actually input credentials to share with your team, right? So this is kind of a quick overview how for example, you can aggregate them by severity if you want to, right? Let me put this in all pages. There you go. So, and you can expand if you want to. These are the criticals, and so you basically play a lot with your vulnerabilities that you import. Now, we did the Nessus, right? So the good thing about this is we are agnostic. So if I go and add, let's say, an open bus report on top of the Nexus that I already have, from Faraday point of view, we don't really care where the tool comes from, OpenBus, Nessus, Qualys, NetPoser, Nmap. We just import it and treat it the same. The only difference will be that your tool ID will be slightly different because it's a different tool. Let me see if I can order. By the other way around. You see, tool ID is where the tool this information comes from. If you click on it, you will see the description, technicals. You can change the fix. You can change the severity. You can confirm. You can do a lot of stuff. Attach screenshot, technical details, custom fields, and comments. Comments is a useful feature for multi-users when the people working on either the vulnerability management or the pen testing itself. So allow us to leave some comments or message between users. For example, this one, I can leave a comment here at John. And I change the severity to critical actually and confirm this vulnerability because I'm sure it is, and it's simple to fix. I did all that, no? And leave a comment. Now, if I go log out, it says John. All right, I think it was Nessus. Yeah, Nessus. So you can see here there is a 1 notification. That's because someone leave a comment to me with the @ So if I go click on it, and I can see the comments that someone leave to me, and so it's allow me to have an interact between teams, mainly when people is offline, online or different locations. So that's quite cool feature. Of course, the searching and playing with the editing and bull creation, etc., etc. So we also have the cool part, which is the reporting. So the reporting side, we can create a report. So I can choose a template, right? So for example, this is a generic template that we provide. You can customize the templates, basically docx format, and you can say, I can put details. All right, then you can scope. And you can also do the cool part is you can also put filters, which is on the tagging side or severity, or maybe you don't want to report on the 300, so we want to want the criticals and the highs, for example. Oh, and I was John. Sorry, I did all that, and I was not. John is just a read-only user. It's not this. But anyway, maybe there you go. Well, I'm not going to create it. I'm going to put the critical and the highs. This should open. This is going to be probably open maybe in a different tab. Let me see if I can. You guys see this? Oh, maybe yeah. Right. So this is how we also chose all the details will go here, and you can customize whatever you want. And we also decide to report on criticals and high only, right? And it will give you all the details of each vulnerability. So this is a way to automate reporting and pen testing. Okay, so we also have new features. So for example, we go to November. There's a new dashboard. A workspace. This has nothing on it. So let me show you how the features. Let's do a small Nessus import, and also operations. So in operation, no, this is features in settings. We have something called workflows in October. So workflows allow me to select specific details and take an action on it. So for example, let's go to vulnerabilities, and I have Nessus bring this, Nessus sync scanner. What I'm going to do, if I copy this and I click on it, yeah, click on it here now. Let's go rid of that ones, workflows. So I can make a workflow of October. So when there's a vulnerability and the name is equal to sync scanner, then the action will be, I already have defined an action called delete, save action, and create a workflow, right? And this is active on the workspace. So what this does is allow me to create a specific workflow for actions. So when I import data, when I have data on it, vulnerabilities, in this case, we will actually delete those things, right? So let me re-import and actually refresh it. Yeah, I have them here. So I have 35. This should kick on. Where is it? Let's import it. Oh, October. Sorry, we created in October. So November, we didn't touch it, right? So let me go to October. There you go. So I'm putting November and October, the two reports, exactly same files, no? So they should have the same amount of vulnerabilities. Which was 35, I think, in one report. There you go. Here we can see that when it found the condition scanner, it will delete the object. So this is all the rules matching. So I only have 11 left. So now I can do insight, can do something called workspace comparison, which I can compare to workspace. And this will give me information about, for example, if I run every month scanners on the vulnerability management, I will see the difference of what happened and what did not happen between the months, amounts, details on the ports and servers, the host. In this case, there's only one host. So this is kind of how mainly the GUI works. Also, for example, if I go to a vulnerability particularly, oh no, this one, let me edit it. This one, and I can edit, right? I can actually have something called knowledge base where I can put my own details about vulnerabilities. So if I close this, yes, if I mark it and I click here, create template, what this is going to do is from this vulnerability is going to create a template. So now if I go to knowledge base, I have a template, I think it was this one, which I can actually modify and put my own. This is, I don't know, high. I can put more explanation, I can put moderate. I can actually put different language if I want to. I can change the details. I can add reference. I can add policy creations, custom fields, details on it. Then what I'm going to do, Spanish as well. So now I have that template. So for example, if I found a vulnerability, let's say, I don't know, this one, right? Let me change it. My mouse is here. There you go. If I edit this vulnerability, I can actually, this is SSH server type, blah, blah, blah. So I can look for my search in my template and I can automatically replace with all the information that I put on it. So if I click OK, that get rename it to whatever my template say. It was this one. This one actually. Yeah. So this is one way to do it. So this is pretty much all the, let me see if there's anything else I want to show you guys. Okay, so this is pretty much all the GUI part. One more thing is, let's go back to the burp thing. Burp. It was empty, maybe still running.
Hey, what this is going, I have a question. This is great. Thank you for showing us this. Can you do maps? Can you do like a greppable or XML export and then import it?
For example, let me go to another, this empty workspace. When you, I don't have an nmap, we do one now. Let's generate a report. Nmap. Let me show you in the GUI, in the CLI, it will be easy for the nmap. But yes, you can import nmaps directly, files, XMLs from nmap and different tools, JSONs and XML. Some of them, for example, Open SAP actually is an XML. Some of them are OpenBus is an XML. Nuclei is a JSON, or Nabu is a JSON. So depend the tool. In case of nmap, is an XML as well. So depend the tool, you can import the format the tool provide you, but also you can export. And when you, this is your, for example, your workspace, this is for importing, but this is to export into CSV. So this will generate the CSV of the columns you decide to put or not to put. Actually, you can add columns here or not, and whatever the columns are you displaying are the ones you can export into a CSV file. If, let's say, if you want to play and put with something else. Does it answer your question?
Yeah, we do have Jim. Can the report be created automatically on
Yes.
index? Yeah, go ahead.
Like to be honest,
Yeah, thank
running
you.
the tool.
Thank you. The question is, can the executive summary, the part that you want the people that make decisions and don't have a lot of time to read the entire report read, can that ever be authored programmatically? Because I've been looking at GPT-3 and all the trillion parameter models that they've been trying to do to get generative. I don't think they're anywhere near. I don't think they will be anywhere near until we have like millions of kilobytes of quantum RAM. And right now we don't even have a single bit of quantum RAM. So my question is, do you always want to have a person, an individual person or perhaps a person and their editor, maybe a larger group, I don't know, authoring the executive summary? Or do you believe that someday you will be able to make a computer program that can write a correct and informative executive summary for a pen testing report?
Okay, that's a very good question. The way that I'm showing you the GUI, right? In the GUI, yes, this is humans interaction mainly. You actually write this stuff manually. What you can do is automate that writing, but you do need to have a template of what you want to write on it. Like, all the pen test, the reports are going to be the same summary. If that's the case, or maybe some tags they can replace, some logic into it, you can definitely script it that, because we provide you a CLI, which I'm going to show you now, that allow you to generate reports through the CLI. So that summary is most likely a feature
Correct me
that
if I'm,
you can.
please, may I follow up? Correct me if I'm wrong, but you showed 3 text areas, a form with 3
Right.
text areas that would
Mhm.
define the executive summary. And I think that there they are. I'm going to take a screenshot of those so I can refer to them later if need be. But summary, conclusions, and recommendations, those are extremely important categories. But filling them out, I think if we ever turn over the responsibility of filling those out for pen testing reports or any other kind of security-based, cybersecurity or cybernetics kinds of recommendations, I think without a person proofreading them to make sure that they don't say something terrible like, let's maximize the number of paper clips, that's something that we want to prevent. And if we write a program that we believe can fill those fields out, maybe from templates or boilerplate or whatever, we still have to guard against the possibility that it might say that someday a bug might occur and it might say, let's maximize the number of paper clips, and it would wreck the economy.
Yes, I completely agree. It shouldn't be the pen tester works to do that. That's the reason we have called the template fields. But these come with the box, but you can customize whatever you want. So I will show you how these templates look. Give me 1 second. This is probably you can't see, right? No. Let me reshare this. No? Can you see my screen?
Not yet.
Not yet.
Which one is it? Let me share again. I don't know why I cannot.
Might be your client. It's all right. I have another question.
Can you see the entire screen?
There's some black screen. I'm not sure if that's, yeah.
Oh, this is a problem because I can't really share your screen. Oh, this is going to be a hard one.
Well, I think the question answers itself. It's just obvious that if you write a program, whether it's a single template or a sophisticated program involving the idea of templates with string processing operations of any sort, then, even if it is a trillion parameter model like GPT-3++++, it's not going to be able to defend against the kinds of failures which would be equivalent to saying, let's make as many paper clips as we possibly can. So my question is answered. I'm sorry I was so verbose, but it seems like it's obvious in retrospect. But there's always 20/20 hindsight. Thank you so much.
Yeah, definitely I will show you. We can work on it. I think it's a very valid question. We wouldn't allow the pen test to write that summary or manually due to many things. But yeah. So
I have another question.
Yeah.
And you probably get a lot of questions about it. My turn. TTBs?
Listen,
Do you have it? Do you have mapping for MITRE TTBs?
actually,
Like
you mean like
MITRE?
with the tool? Yeah,
Yeah.
we don't.
Oh,
Let's put it like
okay.
this. The information let me go back to the window. Where is it? I think it's this one. Okay. Yeah. Remember, the vulnerabilities they are coming from a tool, not from ourselves, right? So those
Oh,
details.
yeah, you're right.
Okay.
You're right.
If this tool does provide you that information, yes, we put it here. And you can
Right.
also add your own custom fields that, I don't know, specific for MITRE, right?
Oh, you can do
But
your, right.
if the tool doesn't have it, that information, we don't invent it in a way, right? We need,
Right.
so let's assume you have Nessus scan. If Nessus did not add any CSV on it or CVE on it,
CVE.
we don't really have a pragmatic way to map this vulnerability from Nessus name, which is called that thing,
Mhm.
to a specific CVE, unless they do provide us with a CVE number or values.
Right.
If that's the
It's
case,
metadata.
yes.
It's
Yes,
metadata.
exactly. If we
Okay.
get the metadata, we can display it. That's okay.
Right.
And we can report on it. But we can generate it from, because you can create your own vulnerability manually. I mean, like, you write whatever you want on it. You go and create the vulnerability. You choose a host and you choose your own general descriptions. And so we are flexible on allowing you to write whatever you want, but also we need to import the tools that they already exist. So there's a way to automate, for example, some mapping on it. If you have some details, metadata, like CVE. If you have CVE, there's a way that we can do to automate and bring the CVE details from a MVD, for example. Right? Things like that, it is flexible that we can script it and automate it.
That's pretty cool, man. Thank you very much. And
But
then
now
Could I just say,
yeah,
when I said that a system, an automatic system, might recommend making a lot of paper clips, that's a technical term from the control problem peer-reviewed literature. What it means is that sometimes AI systems or Microsoft Word macros, whatever, can recommend things that are really bad. And we need to be on guard, all of us in this industry, whether we're black hats, white hats, gray hats, whatever. We need to make sure that we're not destroying everybody at the same time, right?
I completely agree on that. There's different ways to tackle the problem. We will be looking into all sorts of ways to try to solve everyone's problems. And we actually really appreciate all the feedback we get. So this tool grows up from the industry itself. Every time we show this in many conferences, we grab the feedback from people and we work on those features. So either useful or not useful features that people use. And so every single question that you have is very valid and useful to us because our use case, that how people use the tool. We discovered this tool was designed to be a pentest report, and people start to use this tool as a vulnerability management, and then people
Thank
start to use
you.
it as an orchestration.
Thank you kindly. And thank you so much for showing your software. It's really interesting, and I hope to be able to run it soon.
Yes, give me one
talking
second.
about that, how we get this software? It's a shareware, is it trialware? What do we need to do?
Okay, so so we release, I think it was last week or this week, Josh may know more than me. We release, you still see my screen or no?
No.
Chromium is not responding. Wait. What about now? No? No. I don't think you like it anymore. Let me see if I can.
Perhaps you could just post your repo link to the chat.
Yeah. Give me 1 second. There you go. I'm just joining in a different computer. So we have a, where is the chat name? There you go. There, here.
I just made you presenter on the second computer, so you can share from there.
Okay, great. Let's see. This one. Let me see if you can share the screen. Yes. Okay. So I think it should be a whole screen. Yeah. And this will be, if you go to our website, we released version 4. So we have the GitHub. This will be, this is our GitHub, where you get the community version, right? There's installation process and a lot of documentation. But we released last week version 4. Version 4, what it has is a how do you call it? Personal. It's a per person. So you register, and what you get is a version. Let me see if I can log in. We create an instance for you for free, forever, of the software I was showing you. But the version 4, what it has is a new front end, but the back end is the same. It's pretty much what I was showing you, the functionality, but it's just a mainly different front end. So what I'm going to show you now is okay. So we have a tool called, switch keywords, Faraday Clip. Faraday Clip is our basically CI, which allow you to play with all the things that I did show you on the graphical interface, but using the CLI, SSH console, basically. So let me authenticate. Okay, once you authenticate, you either can run it from a specific, for example, CLI command, and you tell the workspace like nuclei, I think was it, and you give a nuclei report, for example, this one. So you can run it like that. What it does is going to be sending that nuclei report into Faraday, for example, from a CLI. I have too many mouses. This one. That was.
I managed to get your free trial full version URL posted to the chat, but could you copy and paste the GitHub link into the chat?
Yeah, this one. I think it's was meeting.
Thank you so much.
Right. There you go. So now if I.
That's fantastic. So good.
Just to clarify on the free trial, it's not really a trial, it's a full version. So it doesn't expire. It's designed for individuals or small companies that they don't really have a security team, or it's very
nice
small fit
Nice.
So we're trying
Very
to go
nice.
back to the community and provide people with the easy and right tools to work on security. Our goal is to make security aware everyone, but not everyone has the know-how and the skills. So we provide it for free. It's not a trial. That's what I meant. It doesn't expire.
That's pretty amazing, and thank you very much. This is, I mean, I can tell you as a pen tester, sometimes in the past I've been forced to buy certain commercial products basically because of the reports. Doing the
Right.
report was an absolute nightmare. The outputs from tools are disparate. And obviously you have your clients. I'm not sure if Provinsky's here, but he could probably tell you too. It's a nightmare to try to put all this stuff together, and this is it comes out nicely. They present it in a PDF. That's pretty awesome. This is great.
Yeah, about the, let me see if I can actually, what was it? This one. That's the one I'm looking. Oops. I think it's, I just want, this keyword is in Japanese as a reason. The layout is different. This is, I'm going to show you the template, how it look. It's a Word macros document. This one. Yeah, there you go. How do I open Word? Word? I will do. No, here. Open. Where I went. This one. Do you guys see the screen? Yeah, no. Maybe make it bigger. Maybe?
Yeah,
Yeah,
I see your document template, but I want to say that I think we only have 10 minutes left for the bioinformatics talk. So
Yeah.
I have to go at the top of the hour. So I would love to be able to make sure I at least find out how to get the recording.
Right. Okay.
the
This is the
recording.
template as quickly I
Yeah, the
explained.
recording will be under. I can actually place. We have a YouTube channel. YouTube.com should be under Pacific Hackers. I'm gonna paste it right now. And we're about to. I think we're. Are you, Emilio? Do you still have stuff, or are you getting
Come
there?
again? No, I think we are good. I mean, I'm just showing you how to automate stuff during the clip. So maybe, I don't know, 10 minutes? Do you have 10 minutes? No, 8 minutes?
Okay, that's great. Any other questions? I just posted the link to the YouTube channel, and I will be posting this after we finish today. I will download the video from GoToMeeting, and then we'll post it.
Wait,
Yeah.
so if he's going to have 8 more minutes, then that means I don't get to do my talk today.
Who's that? Adam?
Adam? Yeah.
How long is your talk?
Well, you said that we only have 10 minutes left at
Oh,
all.
no, dude. You can stay here for an hour.
For an hour.
Okay. I'm sorry. All right.
Yeah, no, don't worry, man. We're not gonna give you just 10 minutes to speak. Don't worry. We're gonna give you a full hour so you can. It was Jim who was saying that he needed to leave. Right.
Adam, I apologize. That was me. I have to go at the top of the hour, but I'm going to try and see if I can get out of that.
Oh, okay. I was so confused and worried.
No, man, don't worry. We'll give you get the floor. You get a full hour or more if you want. No problem. All right, Emilio.
right.
Whatever you want to close it up with.
So this is the as I was saying you, I can't really see, it's too far. But anyway, so I can select workspace, select, for example, Nmap, right? That will just tell me that workspace I'm selecting. And if I do just the command, Faraday clear, for example, and then I run my normal Nmap localhost, that running Nmap localhost. But however, because I put Faraday clear before that, if I now go to Nmap workspace, you will see no vulnerabilities because Nmap I just run on localhost is just port. So in finding asset, this comes from mmap. As you can see, this command that I just run in the CLI automatically get imported into the GUI. Maybe I should make this bigger. There you go. So this is one of the things that you can do, run commands directly from the CLI. You can also pipe things up. For example, if I do a, let's call it. So this is one way to automate. Oh, this Japanese keyboard. There you go. And low battery. There you go. So from 3000, where I will find the pipe. There you go. So for example, I call nuclei. Let me go closer to the, there you go. I call nuclei and I throw the template to template nuclei.json, and then I do, and I call Faraday, and I call the tool report. This is the way that you can actually start to automate stuff with the demo. And I can actually, this is the cool stuff. It's called pipeline. Let's call it whatever you want to call it. So, play JSON. So what I'm doing in this line, if you can see, is I'm just giving nuclei a list of hosts and web servers in case this is one. So and send it to a temporary file and call it Faraday to import that temporary file in a specific workspace called demo, and also tag all the vulnerabilities that come through call a tag called I don't know, pipeline. So if I go back to my ID test demo was it? I think it was demo. So this I don't know if you can really see it, but there's three tags. This is here. You can see tags here that say pipeline. So import two vulnerabilities that found, right, that come from nuclei, automatically import into Faraday, and specifically add a tag. This allow me actually to then filter by, tag. In this case, I have two, but let's say I import another. I don't have it here report. Maybe I do. I don't know what's that report for, but hopefully it has some vulnerabilities on it. No, doesn't matter. I can always add it. Here. This is a way to add burp. Remember that you asked about XMLs, for example?
Yeah.
So this will add burp into, what was it, demo as well? Let's put it in demo. Now if I go to demo and refresh it, I got all these vulnerabilities coming from, if I add the tool, from burp, nuclei. They all mix it up, but you see that nuclei tool has actually the tag pipeline. That allows me to, when I do reports or whatever I want to do, I can use tags for filtering things. So that's one of the main features that we are cool. The last thing I want to show, if I have, what do I have? 2 minutes. For example, I want to do a Faraday clip. Let me try to see if I can copy paste because it's a long line. Just to make your life easier, right? No?
Whatever you're typing, we're not seeing.
Not seeing anything, right? Okay,
Yeah.
anyway, I have too many keywords, too many mouse. I will do executive. I can't really see it from here. But let me see if I can type correctly. Nope. Steve, there you go. Report. This is going to be painful on the Japanese keyboard. Well, there you go. Okay. Now intro, and this is where the things goes. If I start to, I will never find the correct escaping keys in this keyboard ever. Things this way. If I start to put like this, no, it's not going to work because my keyboard is just not.
No worries, Ren. That was a great demo. Thank you very much. Thank you, Emilio, and thank you, Josh, for providing us this, excellent presentation and demo. We do have tons of pen testers in the East Coast, and I didn't see many of them today, so they truly missed out. Hopefully, they will watch this talk as we publish it. I'd like to thank you very much, and maybe we'll have you guys someday in the future when you have any updates and other cool stuff to show.
Okay, thank you very much. Actually,
yeah, no, thank you guys for having us. I put my email in the chat, so if anyone wants more information, reach out. We're here to be a resource. So yeah, thank you guys.
Excellent. Thank you again. Adam, are you ready?
Yes, sir. Could you just tell me how to screen share?
Yeah, I'm just gonna make you a presenter now.
Great.
All right. So you're a presenter now. All you had to do is click on. If you had the client, you had to click what it says. There's an icon that shows like a screen. Click on it, and then you can choose to share only the app or the desktop.
Right. I'm going through my preferences right now. Okay. So I gave it accessibility, and I'm gonna have to restart GoToMeeting.
Yeah, that's fine. We'll wait for you. Go ahead and restart it. You're gonna get kicked out, and then when you come back, I'll set you back as a presenter again.
Okay. Hello.
You're twice. Which one are you?
There are two of me?
Yeah, at one point. I just gave you presenter again.
Oh my gosh. I'm gonna have to give preferences again. Hold on.
You should be fine now.
Well, no, now it wants the ability to record the screen.
Oh.
I will have to restart.
That's fine. No, wait. All right. So to all of you that were still there, and we're going to see Adam Finkel in just a minute. He's going to talk about bioinformatics. Looking forward to this talk. Remember, I put a link for the Discord. Keep in touch. You can stay in touch all the time by going to Discord. We have tons of channels, including jobs, trainings, threat intelligence, you name it. You want to be in the Discord, that's where we're constantly talking. And of course, on October 30th, we're going to have the South Florida ISSA Hack the Flag, which hopefully one day we will do it again or replicate it in Silicon Valley. And like anything in Silicon Valley is usually bigger and better. So Adam, are you back?
Yes, sir. Okay, so now I should be able to share my screen.
Okay.
Right? Because you've got to make me a presenter.
You're a presenter now?
Yep.
All right,
now,
go for it.
Just need to, that's weird. Applications, maybe? Terminal, that's odd.
You should be able to, what do you have, a Google Doc or?
No, it's a Keynote.
Oh.
I've just never done this before. Okay, there we go.
Okay.
I'm gonna do that, and I can share the keynote.
Looking good.
Can you guys see that?
Yeah, excellent. Go for it.
Awesome. So this is about a little bit more than bioinformatics. This is really about bringing the fourth industrial revolution to biotech R&D. And I'm really excited to tell you about the challenges that biotech R&D faces and the opportunity that we have now because the technology has finally come together for us to make biotech research and development much faster, cheaper, surer, and to be able to reach beyond what we have an exhaustive, fundamental, mechanistic explanation for, to be able to make things do what we want while still just treating them as a black box. And this framework that I've come up with to do that with the help of my friend Grace Reed is called Automatic Parallel Exploration of Systems, or APES. And yes, we chose that name deliberately. And so the basic idea is to experiment, model, optimize, and repeat. So here's the status quo of biotech R&D. There's a very long time to market. In fact, it's the opposite of what we see in semiconductors, where we have Moore's law, which says that every 18 months, the density of transistors on a chip doubles. Well, in biotech, especially pharma, we have Irum's law, which is Moore's law in reverse, where every 18 months or so, the time to take a biotech drug to market doubles. Okay, at this rate, we just won't have more drugs, right? But we still need plenty more of them. There are so many diseases out there that are huge killers. I mean, just look at COVID, for example. It was a hugely expensive effort to make the vaccine, but we've still got Parkinson's, Alzheimer's, lung disease, heart disease, and those aren't individual diseases, but whole categories of illness, right? So it's really important that we start treating these more quickly because people are suffering and dying every single minute of every single day, okay? If you've ever watched a clock tick, that's about how often somebody dies, okay? So if we ever want to beat the Grim Reaper, we are going to have to go a lot faster than we have been because it seems like we'll never get there. Now, in business, time is money, and in biotech, it's no different. Turning dollars into discoveries runs up a huge bill. You wouldn't believe it, but the idea of the underpaid scientist is largely limited to academia. In industry, you can make quite a pretty penny as a research scientist, and you're going to need plenty of them to bring a drug to market or a synthetic biology product to market. And then you're going to need support staff, everything that you would need in a regular business: legal, accounting, HR, sales, marketing. It all adds up. And the longer that you have to wait in that vulnerable early stage of preclinical development before you get that momentum behind you, the easier it is to say, well, I guess the research just didn't turn up anything viable. Looks like we're going to have to close up shop. And then it's not a question of when, but a question of if. And that brings me to the third point, where we have lots of overruns, delays, and failure in the biotech industry. Irum's law is claiming plenty of businesses and startups, and so that limits opportunities. It is very hard to get people to take you seriously now because biotechies have gotten so paranoid. Okay, I've had people say, well, geez, if they're not from the Ivies, why am I even looking at them? Because of these huge risks. So this is something that has got to change. And that's why we came up with APES. So the first problem is that experiments are done right now largely in the industry like they were 200 years ago. There's a person in a clean white lab coat with some beakers, and maybe we have some slightly nicer bench tools, but that's about it. They're doing the experiments manually. It's slow. You can only do them one at a time. You can't do very many of them at once. And there's a lot of human error and random noise that gets worked in. Well, now, and for a long time, we've had these machines that allow us to do many experiments at once. So we want to use those machines to do many fast experiments that are, because they're mechanical, repeatable, right? Test each hypothesis multiple times and test many hypotheses. Of course, we've had these machines for a while, and the next challenge was what to do with all the data they create. It was actually surprisingly difficult. There's a lot of uber proprietary software and firmware on these things. And it's only been in the past few years that companies like Benchling and Datadot have created commercially off-the-shelf services that would let us manage the torrent of data that these really expensive, really big, high throughput machines create. But even with that, and even with both of those services rapidly decreasing in price, as they have, there was the problem of what to do with all of this data. Again, just talking to data scientists in biotech, the response I got was that mostly they do things like you might have done even 50 years ago. You try this regression, that clustering, all by hand, and it usually turns up nothing because there's just so little data and it's such poor quality, right? We need some way to take that human limitation out of the system, right? And generate suggestions for new experiments automatically, so that after we've run through this process of generating the data in the high throughput machines, sharing it seamlessly to the data scientists, and generating a hypothesis automatically, we can iterate. Because that's the other thing about biotech. It's a loop. It goes around and around and around, as you can see, right? We go from these high throughput machines to the what I call cloud lab notebooks, to the automatic machine learning, and back again, okay? Each time refining what we're accomplishing, right? Getting closer and closer to discovery. Now, let's talk a little bit more about when to use this, all right? It's not a silver bullet, and there are simpler ways of getting the job done. Bristol Myers Squibb has done some very good deep learning work in chemistry, and the key thing is that the system has to be unknown and complex, okay, for apes to really be worth your while to adopt. The experiments have to be slow and costly. You can't just have huge piles of, reactants and to be able to do 1 million experiments really cheaply, because at that point you might as well just use deep learning, okay? And that it's a trial and error process where there's a lot of unknowns. Here, it is worth it to adopt this process because you can't just brute force it by trying every possibility, okay? So let's go into a little bit more depth about each of the subsections of this apes loop. We start with high throughput experiments. As you can see, there are many of those pipettes, right? And this isn't the only kind of high throughput machine, but it's a very common one. This is one that does a large plate assay. Essentially, each of the plates that you see there has many, many little wells. And those tubes, those pipettes you see, inject things into them. And then some reaction ensues. Maybe you're putting yeast cells into agar jelly and the cells multiply and you see what they make because you're trying to get the yeast to make biofuel for you, okay? And so you can see that these machines allow you to have many trials at once. It's not just one person with one of those pipettes and one little well that they're just trying to squirt stuff into. This thing runs really fast. It can do each of those plates in under a second. The equipment is completely automated, so it's consistent. And even though you do still have to pay, even at the low end, a few grand for a machine like this, the unit cost of an experiment, especially once you have plonked down the cash, is very, very low. So there's no longer a barrier to running a lot of them as long as you can afford the reagents. And furthermore, not only can you test many possibilities, but you can test each one many times to make sure that positive or negative results aren't just flukes. Now let's talk about the Cloud Lab notebooks, step 2 in this process. They let you share data and notes seamlessly. So everything from saying, well, what was the concentration of hydrochloric acid in this well, to, oops, I jerked the machine when it was working. I think this data set might be a little skewed. All of it just works. And that is the promise, and it does deliver. It is dead simple to use. We have tried Benchling. It is amazing. We haven't tried Datadot, but I'm pretty sure they're going to do a good job of it too. And the key thing here is that they are automatic, especially Datadot will just suck the data right off your high throughput machines and put it on the cloud, where you can go manipulate it with Cloud Lab notebooks like Benchling. And they will work with standard software. They are available completely off the shelf. You don't need any special training. It's not some complicated contract thing. It's a lot more like honestly using a Jupyter notebook than anything else. It's not even like trying to work with some cloud provider. It's not even that complicated, okay? And finally, the pièce de résistance. So this automated machine learning, right? The big hurdle here has been the small size and high dimensionality of biological data. And it wasn't known whether we could do ML on it, but thanks to the tireless efforts of people from a consortium of national laboratories in the US, we have developed an algorithm that will crack what is called the small n problem. It models the biological system, suggests new trials, and works without having to understand the underlying system. It treats it as a black box and just looks at the inputs that you have and the outputs that you want, and it will find things that humans just can't because it considers so many things at once. So let's take a look at an example from the paper that was published when the national laboratories came out with the automatic recommendation tool, okay? They used it for several things. One of them was to brew hoppy beer. So to brew beer, you have sugar and yeast in a deoxygenated environment, right? And you're going to have carbon dioxide and alcohol come out of it. Now, just a quick question here. Is there any way that I can minimize? I guess not. Okay. So as you can see, this gets really, really complicated. You have DNA, transcription, RNA, translation, protein, and on. And you have all these equations and simulation outputs. It's really difficult to just model this thing as some, y equals mx plus b linear situation, right? So the way that APES helps is that it doesn't have to deal with all of that complexity, right? It just finds the relationship between outputs and inputs, right? All you need to figure out is how to get the biggest byproduct yield of this metabolic process that already exists in the yeast, but that you have created some edit to right? You've modified the yeast's DNA to produce a different byproduct, right? And you verify this in the wet lab, right? Where you create Franken yeast with a different number of protein regulators. So those control how much of a certain protein is expressed, right? Those are your inputs. If you have, depending on whether they promote or inhibit the expression of the protein, you're going to have a different amount of it expressed, and that's going to affect the metabolic process, and so the byproduct that you're looking for. And then you grow the Franken yeast in batches, recording the data into your cell database. So that's where we were talking about the high throughput experiments. Imagine having a whole bunch of this Franken yeast, all in slightly different strains that you've engineered. And you have a dozen examples of it in each row of that assay plate, and being able to try all of them at once without having to spend all day in the lab setting everything up, right? Now, if the data differs from the prediction, you can make the simulation match and try again. So the idea is that you can feed this information back into this small n machine learning tool called ART, the automatic recommendation tool, and it will learn from its mistakes, right? Now, if you've got matching data, you've got a new vector to transfect into Chinese hamster ovaries. I will not go into the details of those so much, but you can obviously do more with this than just brewing yourself some beer. You can also grow monoclonal antibodies, okay? So a monoclonal antibody, what is that? Well, monoclonal means that they are all cloned from the single cell, right? There's just one common ancestor that they have, right? And they are designed to bind to one target. So you've chosen something that you want to target in the body, and you design a white blood cell that will produce the antibody that will target that thing, right? And then you clone the white blood cell and extract these antibodies. And the crazy thing is that you can get the antibodies to stick to just about anything. And whatever binds to the antibody will bind to the target. So let's say that you wanted a chemical that would neutralize a toxin. You could have it bind to the antibody, right? Which binds to the toxin, the chemicals interact, the toxin is neutralized, right? And these are used throughout biochemistry, medicine, molecular biology. They're an already existing and established tech, right? So again, apes can help here. So the way that DNA affects how these antibodies are produced is really complicated, and it's pretty chaotic too. The cell isn't so much a neat, orderly little city, more like a wild party where things just kind of crash bang into other things, even though there's some order, okay? So if you're trying to get the cell to produce something, you kind of just have to treat it like a black box, where you have just a certain number of copies of this gene and some other copies of another gene, and you can have more genes than two, obviously. This is just a really simplified graph, right? And this small n machine learning, the ART, the automatic recommendation tool, will say, okay, we've seen how fiddling with each of these affects the output. Here are some suggestions to try, right? And then you can try those simultaneously and quickly in the laboratory, right? Have the data hoovered up into those Cloud Lab notebooks and feed it back in to improve improve the automatic recommendation tool's guesses, right? So the wet lab verification works very much the same as the as in brewing the hoppy beer. You create Franken DNA with the number of gene regulators recommended by the automatic recommendation tool, or APES, depends on whether you want to take the big or small view of it. You grow the Franken DNA in Chinese hamster ovaries. This is a common cell line that we use for this kind of work. Recording the cell data into your cell database, and if the data differs from the prediction, right, you are going to have to make that model match and try again. If the data matches, you've got new data to transfect. So here's a little bit more about that automatic recommendation tool so that you can visualize it. It's a little easier to see, right? So on the far left, you have each of these instances, right? Each of those would be, say, one row of trials in that big assay machine, right? And you have a different set of inputs, right? And these could be anything. Proteomics, so that's about protein. Transcriptomics, which is about the transcription of DNA into RNA. Promoter combinations, media components, you name it. And each of those has an associated response. You feed all of that into ART, and remember, you're not going to get flukes because you're trying this many, many times at once, right? And it gives you, right, through this artificial intelligence, recommendations for what you should do next, right? And you can see that little graph there, and that's what you try in the lab, right? Now, how does the automatic recommendation tool work? Well, for all of you ML heads out there, it combines a priori knowledge and data, which is the stuff that you know going in, right? You happen to know that the system works in such and such a way, that, you know, this is how the experiments were set up, et cetera, et cetera. And then it does something pretty incredible. Rather than taking a deep learning approach of using a whole bunch of data to try to almost brute force its way toward the truth, it tries every traditional machine learning model at once, essentially. And the thing about traditional machine learning models is they're not as good as deep learning, but they're much more robust. They don't need nearly as much data to give you a good recommendation. They can fail if they don't get a data set that they like. But in general, if you get a whole bunch of them, many of them will succeed. And if you have another layer on top, this sort of Bayesian layer that looks which way the models are pointing, even if some of them have failed, it's not going to be swayed too much by them. And it creates a joint probability distribution of its best guesses about what the system is doing. And those are the ones that you try in the lab after it optimizes them, right? If it guesses that, you know, tweaking such and such gene is going to make the cell produce more beer, right, or more monoclonal antibody that you want, right, then it will crank that gene up for its next recommendation. And as you can see, we don't need to have a breakthrough in fundamental biology to deliver some sort of full mechanistic explanation of what's going on. It's entirely a black box approach, and that's all enabled by something called TPOT. Okay, it automates model selection. So you have to get the raw data yourself. That's coming from the cloud lab notebooks that are being fed by the high throughput experiments. Yes, you're going to need to do some data cleaning too. This isn't a full automation of biotech. We're still going to need people, but they're not going to have to do as much grunt work anymore. And the rest, TPOT takes care of, from feature selection to feature preprocessing, feature construction, model selection. It delivers what you need, which is a model, right? And it does not require you to understand how the system works just to associate these inputs and outputs, which it does itself, right? And so it works by copying your data set many times, tries different features, and then eliminates them and figures out which ones are the ones that are important and predictive. And that's really the conclusion of the talk, okay? These technologies, each of them is revolutionary, but like apes, they're stronger together. And if we combine them, we won't have to deal with nearly as much cost in terms of manpower, risk of things going wrong because we just can't guess the right model, time of having to grind and grind away by hand at tasks that we could automate. And we can transcend the limits of biological research, right? Even if we don't understand, for example, how a heart grows in all of its glorious detail, we can still grow a heart. And to everybody with heart disease, right? All those millions and millions of people out there, that's what matters. To everyone with lung cancer, they don't need a textbook, they need a new lung. And if we can create those, then we can save their lives, at least for a while. In the meantime, we'll be able to do all of the, grand and glorious endeavors of synthetic biology, of curing Parkinson's, and maybe even reversing aging. But for now, it's essential that we be able to at least get biological systems to do what we want, because the effects go way beyond just healthcare. We can make biofuel, beer, or even use these cellular machines as little factories to make any material that we want. If only we can program them. It'll be a fourth industrial revolution combining biotech, computerized manufacturing, and artificial intelligence like you've seen here. So the opportunities abound. If you go online and look at synthetic biology, machine learning, you'll see that the number of papers about them is just skyrocketing. All right. And what we are most trying to do is build a community around this and just start talking about it. Because we, Grace and I, and everyone who's working with us, want to know what the specific challenges are, because we founded a company to try to make it happen for biotech companies. Right now, it's just about consulting and custom solutions, helping them figure out what exactly they need and setting it up for them. Because remember, a biotech company is pretty busy doing research, and the one thing it can't do is take people off the production line, even if it had all the money in the world. So we do think there's a business opportunity there. But our biggest goal is to make biotech go faster, because we have so much time left in our lives that we could really see many of the benefits. That's our personal motivation. And there are so many people out there suffering and dying on organ transplant lists or of cancers that if only the organ could be removed, the person could be saved. And everything else, synthetic meat, biofuel, you name it. If only we could control these systems, whether or not we understand them, and to do it in an economical way, we could change the world. Thank you, and I'm happy to answer all of your questions.
Thank you for this presentation. It sounds pretty interesting. I'm not an expert in any of this, but I was going to ask you, have you reached, like, for example, people like the Open AI Foundation, for example, for like processing power, and or do you have like proof of concept of some of those processes you showed in the slides?
Yeah, so we got an academic license for the automatic recommendation tool from the national laboratories, and we have been trying to get it to work on some data that Grace has collected. And it's been tricky work. It's kind of a complicated tool to use. But we do believe that it's something that can in fact be harnessed. Now, the other amazing thing is that even though it's the IT challenges can be a little tricky, it's not a question of having enough processing power. This is a totally different approach from the gazillion parameter, racks and racks of stacks on stacks of graphics cards or even custom chips to power, massive transformer models that machine learning has taken before. This will run on a laptop, an old laptop.
Interesting. Thank you. Any other questions? No more questions? Anything else you want to tell us?
Actually, I have one more quick.
Yeah.
Interesting talk. So this is part of my industry. So how does this differ from what's going on with traditional high throughput screening in laboratory environments right now? And also how this almost seems like a combination of high throughput screening along with like compound management through automation. Am I catching this correctly? But then you also have a component where you can actually lead the scientist down a path more. So kind of how is it different than CMG and high throughput screening?
Well, first of all, it builds on high throughput screening. So that's the foundation of this. If there weren't enough data to analyze, then this wouldn't be possible at all. So the idea is that now we have these high throughput machines. What can we do with them? Can we get the data off them efficiently? And can we analyze it in a way that, like you said, will, rather than leaving the scientists to kind of wander the woods hoping they stumble upon the treasure, to more circle the drain, okay? And that's the difference that art provides. That's the challenge that it's cracked. You're not going to be sitting around getting r²= 0 for everything. This will figure it out. They've tried it, they've used it, it's worked every time so far.
And then so your larger component of apes is kind of trying to, not trying, I guess, because you're doing it, right? I'm just trying to make sure I understand. Where you're trying to tie these kind of disparate systems together, and to be able to provide people with clear data points more rapidly.
Yes, exactly.
Great. So what institutions have you partnered with? You said that you have some licensing with National Institute of Science. Mm-hmm.
Yeah, so that it's Agile Biofoundry that we got the art license from. And so far we've just been doing things on our own because, I mean, for one thing, I've had to learn a heck of a lot about biotech. Had to, every month I was getting my mind blown and going, oh, it's this, it's that, it's the other thing. And I don't even mean to brag, but like toward the end of it, when I ran into the art paper this summer, I was like, oh, what if we tried all the traditional machine learning models at once? And then lo and behold, that's just what, a bunch of postdocs and PhDs and professors at the national labs have been working on for the better part of several years. So the whole field is kind of in flux, and it would be tremendous to be able to partner with some institutions, and that is what we're looking for.
There's to further complement that, there's also a big push right now in lab automation to do cloud labs, right? Where everything's completely done by robots, where they dump to AWS buckets and stuff like this. I would think that would kind of be a perfect fit for this, right? We have our little cloud labs. We say we want to run these chemicals, against these compounds. We want to look for these reactions. It's all done by machines, no more human mistakes. And then the scientists can then easily get that data all from their cloud lab notebooks. That's pretty exciting stuff. Thank you.
Yeah, that's exactly the dream. Yes. The idea is that you literally just log in to a website and you say, I want to do this, this, and the other thing. And all you have to do is every so often you get a little buzz push notification on your phone. And it's like, do these suggestions seem reasonable? Yes or no? And, the lab kind of runs itself. Now, obviously, it's going to be a heck of a lot more complicated than that. The devil is always in the details. That's why, you know, we've got one guy who wants to work with us, and he's in lab ops. So I would love to talk with you some more about this. I'm available all the time. Why don't I leave my LinkedIn in the chat for you?
Please do.
Great.
Any other questions?
Are you Zifty, by the way, guy who was just talking?
No.
Loki.
This is a sheet.
Oh, you're Loki. Never mind. Okay.
So why don't you post your LinkedIn for everybody to see, so you can decide when we send you a connection request whether you want to connect with us or not.
Yep, that's just what I'm doing right now. I've been spent the past moment or two wrestling with GoToMeeting because I almost never use this platform. So I'm very confused. I was trying to find my mouse, figure out where the like little box to input things is. Usually I use Zoom. If you want to check out the company website, it's here too. We have a Twitter.
You can also show, yeah, just share it on your screen, and we'll.
Oh, sure, yeah. New private window. Can you guys see me right now?
No,
your screen is all white.
Right.
The screen that you're sharing is all white, so I don't know if it's the right window or device or whatever.
How about meow? No?
No, you have to share again.
Here. How about now?
Nothing. Oh, something's coming up. Let's see. Yes. Frankentech, automating bioinformatics.
Yep. And so here's our website, our framework, and the Franken Twitter.
Are you Boston, aspiring software engineer, physics senior at UMass?
Yes, sir.
Huh, we're already connected.
Oh, that's fantastic.
I just sent you a connection request. I'm interested too. I like what you're doing, but I have to say there's a whole lot more to bioinformatics than therapeutics design. There's diagnostics, and there's of course, you already know that's quite a bit of overlap. I'm sure you've already considered, but there's also remediation systems. I work in pronunciation assessment for language learning, and a lot of my customers involved with speech apraxia, a condition where young children often will just refuse to speak, or they will speak in a halting manner in such a way that is often described as a speech impediment, but is often more behavioral issue that doesn't have to do with the motor or cerebellum, but it's more hypothalamus limbic system oriented.
Wow, that's really incredible. I mean, our focus has generally been on biopharma and synthetic biology, but now that you mention it, yes.
Yeah, I can tell. Yes, it will. If you go to the MESH, the medical subject headings used for Medline and PubMed, you can see the whole ontology of all the topics in bioinformatics. And there's a whole lot more. There's a whole lot more than therapeutics and diagnostics. But honestly, don't get me wrong, that is where the lowest hanging fruit is right now, because if we can get something like, as I was saying in the chat earlier, if the Treasury Secretary of the United States decided that they would no longer be doing any financial transactions with anybody who used Bitcoin, but anybody who converted their Bitcoin to CureCoin, which is a folding at home based cryptocurrency based on proof of useful work, useful being adding to the protein folding database using the folding at home screensaver, then it would make it so much easier for everybody who's trying to design antibodies or an algorithm that was trying to optimize an antibody, or somebody's trying to design vaccines, or an algorithm is trying to optimize the possibility that a vaccine might work. All of those are helped by that alternative cryptocurrency, which is maybe a little bit far-fetched, but what I'm saying is I fully agree with you that therapeutics and diagnostics based on these peptides are definitely the lowest hanging fruit. And I wish there was as much interest in my field of pronunciation assessment for language learning that there was in peptide therapeutics and diagnostics, but I think that might take a decade or two.
I mean, it is really cool because I feel like if you worked alongside the people trying to build chat bots and pronunciation bots, that could be really helpful because Google Translate has the same problem that someone with a speech impairment does, right? Neither of their brains knows how to talk
Yeah,
quite
true.
properly.
Google has a solution for that. I'll post the link to Google's solution in chat, but I'll tell you, it's not the best solution. It's not anywhere near the state of the art.
Oh, no, I'm not saying that Google should be the be all end all of this. I'm saying that it sounds like those are two kinds of the same problem. And I would be really excited to see what kind of spillover there can be for the therapeutics side, because it's one thing to make technology that helps people survive. It's another thing to make technology that helps people live. There's a lot of satisfaction in someone who goes from just not being able to talk or barely being able to talk to being able to have at least close to a reasonable human conversation.
I have a question for you. Are you working with Calico at all?
I feel like we've heard of Calico, but we're not working with them.
It would seem like that would be a tremendous area for your work.
Calico.
You know what they're doing?
Well, it's certainly not interior furnishings.
No. Calico,
It's
California Life,
Calico Lab.
and it was set up by Google to do. Google knows they can get knocked off in the search engine business. All somebody has to do is come up with a better algorithm, and they'd become another MySpace. And so they looked around to find where they wanted to invest, for the future. And without going into details, they spent a whole lot of money and decided to go into life expectancy. And they started Calico, California Life Company, which they then gave them $1.5 billion to do nothing but pure research into the aging process, stopping it and turning it around. And obviously that's a really major project. Probably more so for me than a lot of people in the group because I'm a lot older than most of the guys in the group. But
I want to save your life too, Alan. The world would be worse off without you.
Pardon?
There's so many grandparents that we would grieve forever if we couldn't get this done quickly.
That's also true. But what's happening since then is all the drug companies, in simple, there was a very small but extremely well-researched project that showed that, and it wasn't even what they were researching for, but they found it putting plasma into people with dementia, plasma from young people. And they found that it actually made 14 out of the 17 subjects physically measurably younger. And once that came out, all the drug companies are starting to cancel other projects and go into life expectancy. So that's, in simple, what's going on in that field. And it takes $1 billion to $5 billion, sometimes 6, 7, to create a new drug in general. Some may get lucky and do obviously less than $1 billion, but $1.5 billion in pure research, they're going to come up with something, and they're, for all intents and purposes, they're what you might call the state of the art at this point. And that's why I'm asking you. Like I say, it would seem like a perfect place for you to be working because everything is all front end, and you're not dealing with the business elements that people outside peer research have to deal with.
Yeah, I mean, that would be really cool to get a job at Calico. I can only imagine the hiring requirements there would be pretty steep, though.
Well, I'm not talking about getting a job there. I'm coming from a standpoint of what your software can do and how it
Yeah.
works together, what can be developed.
Yeah.
Since they're
Oh, sorry. Someone else was saying Loki?
Yeah, just since they're trying to look at it from a new, not a new science, but a new project, right? They're going to have a lot of data that they need to sift through and a lot of avenues they're going to need to go down.
Yeah, absolutely. It would be fantastic to work with a well-resourced company like that. Honestly, I even wonder to what extent they're not self-sufficient at that point. Whereas a smaller shop might need the services more, but I mean that's neither here nor there. If we could work
No.
with Calico, I mean that would be such an opportunity and an honor that I couldn't even begin to describe it, precisely because of what they're looking to do with life expectancy.
Let me assure you, all companies all face the same thing. So the things that you highlighted, whether you're a multi-billion-dollar company or a small startup, you're still going to face those things. Sometimes they could be more pronounced in larger companies. Larger organizations tend to be behemoths and move as such.
Oh, I just meant that a large shop will tend to say, "Great idea, we'll just try to do it ourselves," rather than trying to, work with vendors. But again, that's just my blind speculation with no MBA and 0 years of, business experience. So,
Well, the thing I would see is if you're doing pure research, you don't have to, how can I say, you don't have to solve a lot of problems that you do when you're developing a drug. You don't have to stop and prove everything in the degree that you do when you're doing, medical development.
yeah, that makes a lot of sense. It would be really cool. Like that's one of the exciting things about working with labs rather than firms, right? It's just so much faster and looser when you're working closer to the state of the art because you're nowhere near a patient. And so, yeah, the drug's kind of wonky, but hey, at least it works. Let's start working on it and improving it. That's victory when you're working in research rather than in development. It would be tremendously helpful to, if any of you happen to know anyone in those labs or anyone like that. It doesn't have to even be the size of Calico, but if you guys know anyone in that space, we are very much open to referrals.
I believe
Well, so for the last 3 years, they've had a requirement that anything that gets done in that space has to be pre-registered. They've stopped allowing people to report any kind of tests, such as the qualification trials that they have at the FDA, for example. Those all have to be pre-registered. So there's a registry of all of the tests, and you can just go through all the experiments that's been registered, and you can see which organizations are doing that, and you can see which ones are most likely to be helped by your technology. I will see whether I can post that into chat. I tell you, I've been having some trouble with some of my image links on chat, but I'll try to get that one for you, the pre-registry.
Heck, send it to me on LinkedIn so it doesn't just disappear when the meeting closes.
Oh yeah, sure, I will do that as well. Thank you.
Any other questions? Okay, if there are no other questions, I posted a invite to the Discord so you guys can join, keep in touch. Today has been outstanding. Thank you very much, Emilio. Thank you very much, Adam. This is the idea of this meetups to bring up these conversations, and I think this is great for everybody. So I thank you very much, and I will see you soon.
Right,
Thank
cheers.
you.